Everyone.
Good morning.
I am Deborah Jackson, and this is none other than Miss
Alfreda.
All right, and so today we're going to be talking to you about glaucoma. Glaucoma, basal cell
You didn't have to, you just could have.
carcinoma, and post-traumatic stress disorder. And so, two things I wanted to point out. Knowing is not enough, we must apply. Knowing is not, willing is not enough, we must do. And this is by Johanna Wolfgang Goethe. And then another saying that I've heard growing up is, an ounce of prevention is better than a pound of cure. So our responsibility today is to talk to you about these three different diseases that has affected us or our family members. And we want to inform you that what affected either both or one of us. I'm sorry. We will show you how we have found ways to understand, mitigate, and prevent, if possible, the effects it has on us and on our children and our children's children. So what we want to make sure that you know is the importance of knowing what's going on in your family history, and then how it can affect and what you need to do in order to mitigate the challenges that will come with any or all of these diseases. So I'm going to talk to you first about post-traumatic stress disorder. So post-traumatic stress disorder, PTSD, is a mental health condition that is triggered by a terrifying event, either experiencing it or witnessing it. The symptoms may include flashbacks, nightmares, or severe anxiety, as well as uncontrollable thoughts about an event. Now, what has happened since PTSD has been more prevalent or diagnosed in individuals more often. First of all, you may see it in individuals who work in a high stress job like the military or even first responders. Now, this has been the known or the expectation to see these individuals will have this particular disease to occur. But what we're finding out now, this is probably the early 2000s. Now there's a more understanding of what PTSD, more studies have been done. We're seeing that it's affecting other individuals as well, maybe those individuals who are in a stressful job, if they're experiencing long-term trauma such as physical or emotional or mental abuse in the home, or even a church setting can be a factor as far as experiencing PTSD. Also, having blood relatives with mental problems, including anxiety and depression, can create an environment where PTSD can occur. So one of the things that I find with understanding or becoming more clearer with PTSD, from my personal experience, we've seen that it's growing. Ever since 9/11 and school shootings, we're seeing more individuals more sketchy or concerned about their environment. They're very paranoid, to be exact, and it's not without reason or not without cause. My personal experience, I was stationed at the Pentagon for 9/11, and I thought I was in the safest place that you could possibly be. Who would ever try to attack the Pentagon? But to my dismay, we were in an office meeting. I had just seen on the news about the Twin Towers, the second plane running into the building, and I was going down for a meeting, and in the meeting I'm seeing people run back and forth outside the room, and I'm like, I'm looking around, I'm like, should we be leaving? And someone comes in and says the Pentagon's been bombed, and my response was impossible. That could not be happening. And the chaos that ensued in us getting out of the building, one young lady that I knew, she's like, well, I'm going to the inner court. Well, there's no way out from the inner court. If they bombed the place, you need to be on the outside. And so lost her. I don't know where she went. I didn't see her for days from then. But just a matter of getting out, and how just everybody trying to get outside. People are falling over each other. They're trampling each other. It was just awful. And once we got outside, you can see all the smoke. It's ambulances are everywhere, sirens are going. And the unfortunate thing for me, well, I won't say unfortunate, but the interesting thing, a friend of mine shared a story where she had a dream about the very thing. Someone was in a big black cloak, and all these little chicks were running out from the cloak with the soot. And when we got outside and looked around, this was her dream that had come to pass. And so it's challenging for me, even seeing planes fly overhead. If it's not near an airport, it shouldn't be this close to the ground, personally. And then even sirens sound pretty weird for me as well. I get real concern there. Now, one of the other things that I wanted to point out as we transition into glaucoma, this is another disease that both Alfreda and myself share. And so glaucoma is a group of is an eye condition that damage the optic nerve, the health of which is vital for good vision. And so the damage is often caused by abnormal high pressure in the eye, and it is one of the leading causes in blindness in people over the age of 60 years old. One of the challenges with glaucoma is it's hard to determine what's in the early stages as far as trying to prevent it. It's hard to determine or diagnose that you do have glaucoma, and that's one of the experiences that they're trying to identify earlier and sooner to help prevent. Now, having a certain medical condition such as diabetes, heart disease, and high blood pressure, and sickle cell anemia can also increase your chances of getting glaucoma, and your awareness of these conditions within your family is very prevalent in you identifying if you have glaucoma or the possibility that you might get it. We talked about having family history and the use of cortisone, which is used as an anti-inflammatory. It's a steroid. So use other alternatives as far as decreasing that use of cortisone. And then for me, my mother has glaucoma, so it's a constant concern that I have to pay attention to and making sure it was good that she shared that information so the rest of us can be aware of what may happen for us.
Actually, I'm the one who had glaucoma, and I was still in the military at the time, and they found it, and later on, I found out that I suffer from diabetes as well. So my glaucoma was caused by the diabetes. And it was interesting for me is that they found the glaucoma first because I routinely get eye exams, because my vision has never been good. So I found out I had the glaucoma first, and then afterward I found out that I had the diabetes. So it was, all of these are kind of interconnected. Okay, so next we're going to go over basal cell carcinoma, and this is the most common cancer. It is a cancer cell that affects the skin. So this is a cancer that you could actually see with your eyes. It is caused by UV rays from being out in the sun or by doing indoor tanning. This is also, it is hereditary as well, so you do have a higher risk of getting it if it does run in your family. It is also higher risk for people who have fairer skin, light colored eyes, but it does affect people who have darker skin as well, and it all depends on how much you are out in the sun. So this is one of the easier cancers to prevent. If you wear hats and long sleeves, and especially out here in the South where it's always sunny. It's not like England where I came from, so it's really easy to kind of forget these things because you're always out in the sun. So you have to make sure that you wear sunscreen that's higher than 15 SPF. I was saying that my husband, actually, when he was a teenager, he's Hispanic and he's from Southern California, and he was diagnosed with basal cell carcinoma on his face. So he's not a light-skinned person, so it can affect anybody. So in conclusion, we have our three diseases here.